Welcome to the I Love CVille Show. My name is Jerry Miller. Thank you for joining us on a Wednesday. It's been a rocky week, I think, for all of us in Charlottesville, but I think it's a week that, we're heading slowly in the right direction if we can flatten the curve like we've been talking. I don't profess to be an expert on many things, but knowing some folks in the community is something I pride myself in. And today's guests, Lindsey Neal and Rebecca Downey, their second time on the show, are going to come to this show. Thankfully, they gave us their time to offer some perspective and some guidance and some facts and some strategies and to serve as a sounding board for us. We are an advertising agency here, and we love to work with small businesses like Interstate and Dr. Wagner. We have seen firsthand from businesses across the economic spectrum of how this is impacting not only the small business owners, but the team members that work in the community and the business, and also the folks that are associated peripherally to the small business owners. This is a big deal. This is a big deal, and I hope it's kind of setting in. We had to reprimand some University of Virginia students on the UVA corner in the Mad Bull off Rugby Road, my old stopping grounds, for not really practicing social distancing. We're trying to here on the I Love CVille Show. We really are, and before we welcome our guests here in T-minus 20 seconds, all I am trying to do, our team, all we're trying to do is be a voice and a sounding board and an opportunity for the community to come together potentially to a spot and get knowledge. That's all we're trying to do. Why don't we go to the studio camera, Judah Wickhauer, and he's our director. And let's welcome Lindsey Neal here. Hello, Lindsey.
Hey, Jerry.
Thank you for coming on.
Oh, my gosh. Thank you for having us.
Our pleasure. Rebecca Downey, our guest over here as well. You guys, your second rodeo on the program. Your first rodeo was awesome. This under very different circumstances.
Yeah.
Of course, they are from Charlottesville Direct Primary Care. Why don't we go open-ended, Lindsey, 2020, March 18th,
yeah,
Wednesday.
Right. Say the date.
Yeah, where are we at
every
here?
day.
Right? Don't you feel that way?
Oh my gosh, like every
hour.
hour.
Yeah.
Exactly. This virus just started in Italy like 3 weeks ago. 3 weeks. So I want to first, before I say anything else, I want to say, number one, thank you for having us.
Yes.
I think you are in a very unique position right now to be a leader in our community, and I am just so honored and happy to be here and to be a regular on your show.
Yes. Thank you for coming.
Number two is before I say anything else, I want to thank the boots and on the ground in the hospitals and the clinics right now, like the nurses and the doctors, the people on the front line who are actually taking care of these people and swabbing people for the tests. Like, these are the people we have to continually, repeatedly thank right now. So Rebecca and I are in a unique position to be able to be here right now, but there's a whole lot of people at the hospital right now actually taking care of people. So I want to continually go back to thanking them. Where are we right now?
Yeah.
This has the potential to be very, very bad. But I think if we start to really make some changes in our behavior, we can potentially have time right now. But I think, I'm treading a little bit of a fine line right now between going down a rabbit hole of despair based on things that I'm reading.
Yeah.
But I also feel like we are in a to repeat the same word, but we are in a unique timing position right now to actually make some difference.
Yeah.
So I hope that we can come together and stay home and social distance to make a change in the curves.
Let's get your colleague and partner in
Yeah.
here. We have a lot of people giving you props.
Oh,
we have
good.
questions already coming in for you. Patrick Kreitzer says, thank you, Lindsey. Oh. Janelle Lynch. Michelle Purnell says, thank you, Lindsey. Gregory Britt, Maura McLaughlin, Andrea Massey, all in some capacity. Thank you, Lindsey. Thank you, Charlottesville Direct Primary Care. Questions coming in from Javier Sanchez. We'll table those for a second. You can write questions to the two doctors through the comment section, and I will pass it along to them. Same open-ended question for you, anywhere you want to go, kind of your State of the Union, if you may.
Yeah, I mean, I think we're here, this virus we never even heard about 2 months ago. We knew nothing about it. I mean, we know what coronaviruses are, but we've never had to deal with this. And then China happened. China's so different than the U.S. They were able to clamp down very quickly, and their numbers do appear to be dropping. So what they are doing appears to be working. South Korea doing the same thing also appears to be dropping and working. Italy and Spain, we all know what's going on there. And they're making some huge changes now, but it's spreading around the world, and every day, multiple times a day, Lindsey and I are learning new things. I mean, there's just so much we don't know about it. So, preface to say that Lindsey and I are board certified in family practice. We are not infectious disease specialists, but we are on the front lines. We are doing the swabbing. We are, there. I mean, there's just not, it's primary care who's going to take care of the people, the vast majority of people. And the vast majority of people will be absolutely fine from what we can see so far. But 15% of people won't. They'll get hospitalized. And, the mortality rate has kind of yet to be determined.
Yeah.
It kind of depends on location, too, and resources, and how quickly this moves, how quickly people get infected, which is why we talk about flattening the curve, because our hospital systems they are completely not ready to handle the influx of patients that will happen if we do not flatten the curve. And so, it's not just people with corona who will die, it's also people who have other problems, who are having strokes and heart attacks or cancer or other things where those resources are being pulled. So, the most unselfish, patriotic thing you can do right now, and global patriotism too, not just local in Charlottesville or Virginia or the United States, but globally, is to stay home.
Yeah.
So.
Yeah. Let's do this. Let's just do a lot of questions coming in. Germany is watching. You have a doctor there that's asking questions for you. 3 people talking. How do we get in this position? Don't even wait for me to prompt the question. I mean, we saw the rumblings. We heard the rumblings. I follow the stock market closely. I remember on CNBC early January, there was talks about coronavirus and the impact it's going to have, and I feel like we either ignored it, or were arrogant, or were presumptuous, or were so stuck in our own lives, in our own bubble, that we didn't care. How do we get to this point?
Yeah. I think there was lots of people worried about this early on.
Yeah.
Mm-hmm.
I really don't want to comment on the political aspect of this right now. But yeah, I think we're behind. But we're behind right now.
You do feel behind.
Yes.
Yeah.
We are so behind.
And this is medically behind from care and treatment of what's ahead.
And testing. Yeah.
And
exactly.
when we thank the people on the front lines and in the hospital, doctors are extremely upset. We don't even have proper protective equipment to be doing a lot of the testing that we're doing. So, I mean, let's just start there. I mean, to have to swab patients and not have the proper equipment to do that safely increases the risk to our other patients. If doctors start to get sick, who's going to take care of the patients? The ERs are already flooded with people who don't have insurance or don't have doctors, and so they're going to the ER to get tested. Nobody at first was even sure. ERs were telling people to go to family practitioners. Family practitioners were telling people to go to urgent care or ER. Urgent care didn't want to see them. Everyone was so confused. And I think that's getting sorted out. But one of the things that we do not need on the front line, Lindsey's disagreeing, because it's still, I think it's getting sorted out in certain places, and other places it is not.
And I think that this is throwing chaos into a whole bunch of processes that were already weak.
Yes.
So,
it is definitely showing every crack in our healthcare system.
Yeah, exactly.
Bullet point that. We talked about that in the past.
Right.
I mean, the cracks.
Sure.
The vulnerabilities.
Right. So people not having access to healthcare, the cost of healthcare being very expensive, not being prepared for this kind of, say this was a biological attack. It shows what would have happened in this case, not having enough equipment, enough training, enough beds, enough ICU, enough doctors.
Yeah.
We can train more doctors. There's no reason we can't open
Italy's
additional.
letting physicians out of med school early.
Yeah. which
Shows where we're at.
it
shows
shows
where
where
we're
we're
at.
at.
Exactly.
Right. So
Yes.
are we more concerned? Okay, let's tie it to Charlottesville, but I think the trends that we talk about in Charlottesville are applicable globally.
Yes.
So while the folks this is a show about Charlottesville, Virginia, while the folks that are watching, like your colleagues in Germany, the topics still are applicable globally.
Definitely. Except for I think that we are I think we're in a good place in
Okay.
Charlottesville.
That was my question.
Yeah, I
Where
mean,
are
like-
we in Charlottesville?
Yeah, I commented on the other day
Yeah.
saying like I think that like those of us in Charlottesville we're in a good place.
Okay,
Mostly
why?
Well, I think that because smart people in Charlottesville, like I think we are all listening to the recommendations and hunkering down.
Yeah.
I also think that we're not like a very dense city, so we're not right on top of each other. We're a little spread out, and then we have like two
Two
very
major hospitals.
good hospitals right here. So I think compared to other comparable sized cities in the country, I think we are in a very good place to weather this virus.
Questions coming in. Here's what we'll do with the questions, and I want the same topic to you. Your page in particular, catching fire right now. Becky Culvert, welcome to the program. You can put your questions in the comments section, and I will relay it to the two doctors. We will get to it in a couple minutes first. Your take. So Charlottesville, we see UVA students playing in the Mad Bowl. We see them at happy hour at Trinity. We do see downtown almost, I don't want to call it a ghost town, not hyperbolized here,
Yeah.
but much less patronized than what it normally is.
Yeah.
Parking readily available.
Yes.
That's a topic for another day.
Yeah.
I mean, less people coming out. What is your take of where we're at here in Charlottesville?
Oh, I've definitely seen huge changes, and I've seen businesses when I've had to go to the food store because we do have to go out and get food, wiping down surfaces, people being careful about opening doors, opening it with their elbows, not using hand sanitizer. So people and businesses are adapting, which is wonderful. It's very unfortunate what's happening at UVA. I know today they announced, Lindsey told me that UVA is shutting down all classes throughout the
They're
No
going,
graduation.
they're going
No.
online for the rest
Yeah.
of the
for
semester.
the rest
No
of the
graduation
semester
either.
and no
Yeah.
graduation.
Which is,
So sad.
yeah.
It's
Right,
yeah.
right?
And my prediction is that that's going to happen with our public school system. I'm basing that just on guessing that this is what's going to happen.
that's a good one.
That the kids will be out of school until summer.
Yeah.
The peak is expected to be
Let's hope
in
not longer.
July.
Yeah.
So, we have several months. And what this is going to do to our economy is huge. To people's mental health.
Yeah.
So that question is coming in. We're going to get to the mental health question. We're going to get to the temperature and the seasonal change in temperatures question. We're going to get to contracting this from metal and clothing question.
Yep. We have your answers.
We're right. I know you. That's why we're here. We're going to get to all these questions. This topic is coming up. Are we more concerned in a community like Charlottesville? Do this both micro and macro. The stress that this is putting on hospital or medical personnel. Italy, they're choosing who is living and who is dying based on their age, which is freaking nuts. I mean, that's the worst case scenario. Are we more concerned about that transpiring or the virus itself?
Oh, no.
Killing,
We are
okay.
we are 100% worried about surging our hospital
Resources.
beds. Resources. Exactly.
Okay.
Yeah.
Put that in an approachable conversation.
So 10%. This is what I've been my mantra these days is 10% of people who get this illness need to be hospitalized and need ICU support to recover from this illness. Okay, so that means those numbers aren't in the case fatality rates,
right?
Because these are people who recover. Right? So those people, so we have to flatten the curve so that we can all use those services if we need them. Does that make sense?
Yeah,
Yes.
yeah,
So
that makes sense.
That's the gist.
What do you think?
Yeah, no, that's absolutely right. I read 15% need to be hospitalized, somewhere between 10 and 15%.
So 15% need hospitalized. About 50% of them are possibly going to not recover, and then the rest of them are going to need the ventilator ICU support to recover.
What do you think about public schools closing?
I think it's the right thing to do.
100%.
right
No,
now.
100%.
100%.
Yeah.
Okay. The questions coming in now, a lot of questions. Let's get to some of the questions. Questions for the two doctors on play dates.
No play dates right now.
No play dates. No play dates at all.
FaceTime play dates. This is what my daughter
Face-
did yesterday. She had a FaceTime play date with her friend, and they did a scavenger hunt. They went around, and they were like doing truth or dare with me and our other family members. So like, it can be done.
What do you say about this topic? A lot of them. Maura McLaughlin, what do you say to the doctors about families that have businesses that they have to run in person? That's a very tough question right there.
Yeah.
One of them is something like this. And a conversation that I had with my wife who's watching last night was about moving forward with this format, which we're going to stick to. But what's the advice you offer to, why don't throw it to Rebecca, to the businesses that some businesses have to interface face-to-face.
Right. So, I mean, that's just a reality. There's
Yeah.
going to be some, businesses that have to stay open. So that's why it's so important that the rest of us, stay at home as much as possible so that when we are exposing those people, that they have less chance of getting it. But the reality is there's people who work in the government, who work with our security, who work in the food industries. I mean, we need to be fed. But anything else, or if it's at all possible to be at home, that should be happening.
So I've been really scared since probably 36 hours ago when I read the paper from the Imperial College of the UK that just came out, and I think has directly changed the way the federal administration is making decisions right now. But essentially, it's a modeling. It's an epidemiologic modeling that they took data from China and modeled it to kind of predict what's going to happen in the UK and the US, right?
Okay.
So there was 3 different models. The one was just unmitigated, and when I say unmitigated, means like doing nothing. Like before we did any of these social distancing that we're doing right now, and just like we just lived life and let coronavirus come, right? Essentially, that curve is the one that everybody sees on this curve, the really tight upturn. Essentially, it predicted that 80% of Americans would get the disease, and something like 2.2 million Americans would die from this illness. And then it gets even worse because, it really surged the capacity for the ventilator. So not only the death rates got much worse,
Yeah.
right? And then all of the people that it affected that should have had hospitalization that we weren't able to care for. So the numbers are really, really high. So some people were estimating, based on the unmitigated curve, was somewhere like 4 million Americans would die, which is insane. Right?
Yeah,
but
insane.
that being said,
Yeah.
we don't have to really worry about that
Right.
because we're doing a lot,
Right.
right? So with the second model showed that with, quarantining elderly people who were like greater than 70 years old, and then social distancing everyone else, they were able to flatten the curve. And the social distancing was like of families. So all families have to social distance together, So which means when you go outside, you stay 6 feet away from other families.
Yeah.
That's
You
what
stay
it
in your
means.
yard.
Yeah, exactly.
Yeah.
Or you can go for a walk, but when
Okay.
you see people, you stay 6 feet away. Like
Okay.
we were walking here and somebody wanted to ask me about parking. I was like, stay 6 feet
Right,
away.
right. And my wife who's watching, we are relatively
yes,
6 feet
exactly.
away.
Yeah, we're
kind of?
yeah,
We're
exactly.
6 feet
No
away.
photo after the interview
Right,
today.
we're not doing the photo.
But so that was able to flatten the curve, but it only decreased the death rates by like half. So that still is like a million people dying.
Right, but still
That's huge.
Huge.
Yeah.
Right, huge.
So then, and still surging our capacity for ventilators and ICU beds, right? But then the third one was with social isolating everyone. So whether you have symptoms or not, like everyone, staying inside. And this was like shutting down workplaces. This was everyone. So that's where I'm getting to, is like your question about people who have to stay working. Like the third model, like shut everything down, and
Except for essential.
very essential.
Yeah, very
like
essential.
It was like super, super essential. But that was able to get the curve down. So like that actually worked. And even with that, the deaths were like equivalent to like a bad flu, which is somewhere around like 60,000 people dying in a year. But
How about this? Kate Bennis says, thank you both for what you guys are doing.
Hi,
People are
Kate.
thanking us for this conversation that we're having right now. Multiple people. Michael Clem says, Dr. Reb in the house. We got a lot of folks overseas, which is your influence. Is it Uchenna Uma?
she's
No,
a
she's
DPC
another
doc.
direct care doc in the States.
I love it. Okay, she says, no fear, please. Let's not act from fear. We can still be objective and not live in fear. That's what we're
Agree,
trying to do
agree.
with the show.
Knowledge.
Knowledge,
Yeah.
right. Petra, hi, Dr. D. Greetings from Germany. Thanks for everything you and your partner are doing. A lot of questions coming in. We're going to get to these questions. Before we do, a couple more from me.
I have to say that I have some hope. I feel like we're at a place where
I
we
like
can
that
make a
about
change.
you. Yeah, you have hope generally, I would
Yeah.
say, across the board.
Yeah, for sure.
Yeah, it's contagious. I see that in you.
There's several medications that are kind of happening right now, pharmaceutical interventions, that none of the modeling took into account. That was all non-pharmaceutical interventions. So there are some medications that are on the radar right now that are hoping to help. And then, the vaccine trials are starting. So yes, we may have to do some of this social distancing for a bit of a prolonged time, but
Yeah.
at least and I'm also optimistic because as people get the disease and recover, there will be some immunity, So as we slowly kind of get through it, with the curve flattened, people are going to become recovered. So all of those things are going to contribute to squeezing that number down.
A lot of comments coming in. So
Can
Dave
I just
Henry,
want to
please,
talk
please.
about. I
Yeah.
want to talk about one thing because this is what I think most people don't understand about why we're asking people to do this.
Yeah.
Because you hear the mentality, well, I'm not over 65, I don't have any medical problems, so therefore, even if I get it, it's not going to be that bad. And that is true. Most people under 65 without medical problems are, they may not notice anything, especially if they're 19 or under, or they may be mildly ill or even moderately ill, but they will be fine, right? But that's not why we're doing this. We're doing this because there's an awful lot of people in this country who not only are elderly and vulnerable, but also children and adults who have cancer or on immunosuppressant drugs, have other diseases that make them more vulnerable. And so, to just say, well, I'm young and healthy, so therefore, I can go out and drink beers with my friends, is not a particularly helpful thing to do, or to think that you're not ill because you can be shedding that virus. And most young people, most adults will be shedding the virus and have absolutely no symptoms. So that's what makes this virus so contagious and so difficult to manage.
Let me throw this to you.
Yeah.
We have 24 minutes in here, and I have a ton of questions.
Shoot.
Before we get to those questions, some broad topics.
Okay.
Parents started freaking out over the last few days exponentially because of the impact now potentially to kids and children and babies. Where are we with that? And can you either demystify or educate or calm? You guys play so many different roles in lives.
The effect to kids right now is very, very,
Okay.
very rare.
Okay, so that's that's
yes.
a positive.
It's a positive.
That's a positive.
It's a
Okay,
positive.
let's say that again.
Yeah.
Okay.
Yeah, there is a very, 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 very low risk to children.
Okay. It's good.
Yes.
So that's good to hear.
I really wouldn't worry about it.
Okay.
Unless your child has an underlying medical condition, I think you can go with everything's going to be okay on
Except
that
for
front.
that they are potential vectors of
Yes.
the carriers of the illness.
So a lot, even your colleagues watching here, Dr. Cookta, welcome to the show. Dr. Tickle, welcome to the program.
Hey,
Children not,
Well,
parents should not be as concerned.
they shouldn't
Okay.
be worried that their kids are going to die, that's not what's going to happen.
Next question's coming up. We're just taking it from mom and dad are at home
So
and they
tough.
have to survive from morning to night, taking one day at a time.
Yeah.
So this question's coming up. Can I take my son and daughter to the playground? Do I
No.
need to even be concerned about
I
that?
wouldn't.
Stay
I
away
wouldn't.
from playgrounds.
Because what we know about transmission, it's not just, we're not staying 6 feet apart because somebody's going to breathe on you. It's because droplets are really a huge vector for this. So, you touching
Fomites.
playground equipment, and kids always touch their mouth.
Yeah.
You can't avoid it. So playgrounds, not a great choice. Hiking, great. You can get on your bike. that's great, but I would not go to a playground right now.
So New England Journal of Medicine had a literature yesterday that that kind of broke down the times on surfaces. So in the air, it's can stay for 3 hours. On copper surfaces, 4 hours. Cardboard can be up to 24 hours. Plastic and stainless steel can stay up to 2 to 3 days. So use your Clorox wipes, friends. Like, please just wipe everything down. I know some people who are like ordering things from Amazon and wiping things down or leaving them outside for 24 hours before letting them in the house and that kind of thing.
We had restaurant leaders, and I think you tuned in on Monday's show. We're talking about one guy that is behind 6 restaurants downtown, Peter Castiglione of Maya, Charles of Orzo, Junction, and the Local. And we had a frank conversation about the food industry and restaurants shutting down. I'm not trying to exaggerate or hyperbolize here, but I honestly think that we're going to see 25% at least of our restaurants in the city of Charlottesville never open back up again after this. 25%. Think about that, guys. So this and the category, the industry, and the coronavirus. You're a doctor. We're going to stick with the medicine part. To-go food, is that...
I would stick with cooked things.
You know,
I
is
would
to-go
avoid
food
salads.
good? I mean, you know, we're not trying to kick anyone when they're down here.
Right.
And the to-go food
Okay,
is the
so,
last straw for,
yeah.
you know what I'm saying?
Yeah, I cannot, in all honesty, feel like it's a safe thing to do, I mean, there's just, especially when we know, and that's a horrible thing to say, and I'm just speaking from my gut instinct and what I know about this, but I'm preparing my own food. I wish I could go out and support our restaurants in this way.
I respect the courage that just took right there.
I am eating at home, but I'm going to order Tabula this week.
Yeah. I respect the courage right there. I mean, because you knew that was not going to be the...
Don't hate me.
No.
No, I want to...
That's why you're the bomb.
I think
you're
we-
being honest.
I'm going to be banned from the restaurant.
No, I don't think that's... No.
I agree with you completely, and I'm going to be cooking from home mostly, too. But I am going to support some of my favorite
B.D.
restaurants.
Hicks says, thank you for doing this. It's difficult to believe the news media. I do trust these doctors. We're going to get to these questions here, like this one, which is coming from Crozet. If it gets warmer, and it's supposed to get warmer, how will this impact coronavirus in Crozet and Charlottesville?
The number one answer that I'll say is we really don't know. I think that's like the theme, is that we really don't know. But there are some suspicions that as the weather gets better, that it's going to spread less. So that's one of my optimisms, is that, as we get into the better weather, that if it acts like the 1918 flu, though, we'll have another surge in the fall. But right now, no one really knows what's happening, and there's some experts out there who are saying that they don't think it's going to be affected by the weather. So there's that.
This is from Kate. She says, doctors, about a viral second wave. What does that mean? A viral second wave?
Well,
I
what
think
Lindsey
that's
was
Russ.
talking about.
Yeah.
So it peaks and then ebbs again. So say in the summer, if it followed kind of, influenza or other viruses, it would decrease, and then you would have a second surge in the fall.
I think we'll also, speaking of like a second wave, I think in the coming weeks, we're going to learn a lot from China, because they're kind of starting to relax some of their restrictions now, and I think we're going to start to see what's going to happen as you relax the restrictions.
Carrie Davis has the question for you guys. I have not heard not to use ibuprofen for the virus. Accurate or internet rumors?
No, it's accurate. World Health Organization recommended yesterday to avoid ibuprofen. Again, everybody's got to remember that none of this is based on randomized controlled trials. This is all just like, observations that, physicians are seeing and scientists are seeing across
Or looking
the
at the
country.
chemistry and saying, okay, based on this, we think it's probably safer to use Tylenol, but not everybody can use Tylenol, right? Some people with liver disease can't use Tylenol or on certain medications. So, for the most part, they're saying don't use ibuprofen if you don't need to. Use Tylenol.
That's one of the things that I am having individualized conversations with my patients on, and the beauty of having the ability to message with me is an added bonus right now, because I have like a couple of people who I have on what I call my COVID protocol. So I think that they're have a cough and a fever, and I'm watching them and I'm checking in with them twice a day, and we're talking about things. So I messaged both of them today and said, like, don't use ibuprofen.
So that question's coming up. You think you have it. The steps you do. Can you ask the doctors this? This is from Tim in Charlottesville. If we think we have it, we don't want to flood the hospitals.
No, flood
if
us.
we don't. Okay.
Yeah.
What do we do?
So when people have symptoms, and the symptoms are generally, it usually starts with fatigue, and then dry cough, and may or may not have fevers, and the fevers tend to be lower grade. If they're
Not always.
for the most part, if they're mild symptoms, right? So that's like every cold in the world. So it's really hard to know. And flu season is like here. We're still getting positive flu tests. So now? Dr. Neal and I are in a unique position because we are direct care docs. We already had telemedicine set up because that is just a direct care doc kind of thing to do. And telemedicine was not getting compensated in fee-for-service medicine, so doctors didn't have the capabilities to do it. That has changed, and they can do it. But a week ago, Dr. Neal and I essentially shut down our clinic to anything but telemedicine. So it's great because we can see our patients. So patients call us. They give us their symptoms. We decide whether, because right now we do not have testing for everybody, and so what we're doing is kind of triaging that, seeing if what are their underlying medical conditions, their age, and what are their symptoms, and we're just checking in on them twice a day. So most people we haven't tested because of the shortage of testing and the cost of testing. And then
we have tested a few people, though.
We have tested some people, and we've had them come in to our parking lot, literally. I have put on my makeshift PPE. I had to get a face shield from the hardware store because we didn't have it. And then we swab them and have them drive away.
So like talk on the phone,
Right.
And right before they come in, they drive up, they roll their window down, we swab them, they
like
roll
a-
their
it's
window
like a
up,
drug
they
deal.
drive away, and then we finish the visit. Then we finish the visit on the phone after they leave.
Get out of
but
here.
yeah. We take our humor wherever we can get it right
I
now.
love it.
Absolutely.
I respect it. Hope is something that I try to pride myself in as well. This question is coming up constantly. It may have came up last night with my wife and I. What's it like with you guys? Stress, anxiety, personally? How about this?
Sure.
When is the last time someone has asked you this question? Rebecca and Lindsey, how is your mental health?
Oh, well, I have to
When's
say,
the last time you've had that?
Nobody's asked me that.
How is your mental health?
I had two neighbors ask me like earnestly, like,
Yeah.
how are you
doing?
How are you doing?
Yeah.
So like, I think people get it.
Yeah.
Like it's a
No.
really scary time right
For
now.
real though.
Yeah.
For like
How am I
actually
doing?
real. How
Yeah.
are you doing? Yeah.
Well, I'm particularly scared because my husband is post-kidney transplant and
Yeah.
immunosuppressed, and so I'm me.
He's watching.
Yeah.
Yeah.
Hey, John.
Yeah.
But and because I'm on the front line, seeing patients, and so I don't want to be the one to bring it home to my family. So I'm doing everything I can to prevent that from happening. But I'm just, I'm trying to sleep, trying to be gentle with myself right now. So.
Same.
Yep.
Same question.
Yeah.
How are you doing?
Some sleepless nights.
Yeah.
For sure.
Definitely. And a lot of doctors, one of the beautiful things about what's happened, because look for silver linings, is I have never seen doctors come together
Oh my
and
gosh,
support
that's
each
so
other and
true.
offer information more than I've seen in the last 3 weeks. So that's been really helpful. I have lots of support from loved ones, friends, and family, so I feel mentally quite fine. But as physicians, we have sleepless nights.
Yeah.
So
I want to also say how grateful I am for my physician community, both
Unbelievable.
locally, my peers from residency, my Rebecca and my peers who are also direct primary care physicians, we've really come together, especially the local ones, and also just across the country. Like my friends from med school, who I haven't talked to in 20 years, we're all messaging each other right now. So I think, our last time that we were on the show with you, Jerry, we were talking a lot about how administrative, kind of bureaucracy has taken over the practice of medicine.
Yeah.
And I just see this right now as like this opportunity for the physicians both in the hospital and in the clinics and everywhere to really be the leaders right now and to like stand up for like wearing the PPE that is appropriate and testing people when they're supposed to. And like, the story of the physician scientist in California who tested that early patient the swab when she was told apparently by bureaucracy of the government to not do it, and she did it anyway. Like, talk about a hero. I just feel like this is the physician's time to lead.
People want to know when we're going to be past this pandemic.
It's not weeks, it's months.
So are we talking?
It's 18 months.
Okay, so what exactly does that mean?
So on the there's that being said,
and I want people to be able to see you here.
Sorry, I keep looking away from the camera.
Right. So this one's right here. She loves the camera.
I keep looking at Jerry, so it doesn't necessarily mean that we're going to be locked down in our homes for 18 months, but there are, and again,
same to you too.
I have some optimism of some ideas and what some of the experts are talking about that we can do. I mean, there's some ideas. One that was in the UK modeling paper was that we stay on social distancing quarantine for 2 months, and then they relax the restrictions for a month, and then we go back into it for 2 months. But essentially,
staggering them.
Yeah. So the post relaxing of the restrictions, but because I think the experts are scared about what's going to happen once the restrictions kind of are relaxed. So watching China right now is going to be really important to see what happens there. But essentially, like until we have like a herd immunity or a vaccination, this is where we are.
Okay, how about that same thing? 18 months, and what happens here can be scaled to the rest of the world.
Yeah, well, it's supposed to peak in July.
Okay.
So we have from now till July where it's going to be kind of at its worst, right? And then it's not going away. It's just going to be, more people. So as we come out, I mean, if everybody's really isolating, people really aren't getting as exposed as much. We don't really know what's going to happen, but we're just kind of assuming based on prior viruses what's going to happen. So no, this is, whatever the government decides to do or the localities decide to do or state governments decide to do in terms of locking things down to a greater or lesser extent has yet to be seen, right? Because Dr. Neal and I do not agree with Governor Northam's idea of what it's
10
50
people, 10.
No, it's down to 10. It was 50 or
Now it's 10.
Now it's 10.
But even that
that's huge.
Doesn't make sense.
That makes no sense.
So, and I'm going to regret asking this question. 4 people in this room right now.
No, increased risk.
Scaled down
Yes,
staff,
and
skeleton staff.
When I told you, I need to think about this before I commit to coming in,
Yeah.
that was what I was thinking about.
Okay.
It wasn't about whether or not I wanted to come on your show. It was more...
You thought about it quickly.
I answered quick.
Yes,
but,
you did.
But
Thank you.
I was worried about being in a room with more people than just my family.
Yeah. Lindsey Milby says, thank you for taking the time to do this, ladies. Forrest Mitchell, these are the smartest, most dedicated, fun doctors around Central Virginia.
Thanks,
this question from Regina O'Paul. How does one get the kind of remote care you are talking about? Our GP's secretary just told us to go to the emergency room.
So a lot of doctors are scaling up now on telemedicine, but it's kind of a new thing. So they're getting there. I've had several doctors reach out to me this week to say, what platform are you using? How are you doing this?
Same.
They weren't getting reimbursed for it, so therefore it was not an available thing. Believe me, doctors have wanted to do this for a long time, but there was a lot of resistance from all those layers of bureaucracy we talked about last time. So now it's happening, but they have to get up and running on this. And this is great because right now I'm not seeing well children in the clinic, but I'm doing well-child exams by telemedicine. I have the parents hold them up. I can look at how they're doing neurologically. We can go over questionnaires, see where they're at. So medicine can and should be being done, and people who have hypertension, diabetes, asthma, any other medical problem should not be ignoring their health right now just because everything's corona 24/7.
Yeah.
How would you, this is another question that came in, if you were advising the president or the governor, and you already talked about the governor, if you were advising the president or the governor now, this is from Stacy Horn,
Hey, Stacy.
how quickly would you recommend a national lockdown stay in place for, say, the entire country?
Hey, Stacy Hom.
Yeah.
So I've been actively tweeting and commenting along with my dear friend Mara McLaughlin, trying to connect with our previous, one of my attendings who trained me, Norm Oliver, who was the commissioner of the state, of the health department right now, to plead with him to
So you
be
say
more
do it
strict,
right now.
Be more strict now. Yeah,
Yeah.
absolutely.
Like yesterday.
Yesterday,
Yeah.
yeah. Solutions, antivirus.
So there are some.
Cleveland, did I read that right? Something's happening. Okay, that's why you're here.
I don't know what I don't know what
I'll
Cleveland is.
stop talking. Yeah.
But no, there's a antiviral. I always say it wrong, so I have to remdesivir. Who one of the pharmaceutical companies, Gilead, is allowing.
It's now in trial.
Intensivists to use on a compassionate use. I believe actually now you have to apply to be in the controlled trials in order to have access to it. But it's there, and it's pretty much standard of care at this point when someone is hospitalized in respiratory failure and are COVID positive, that they're getting this medication. And then there's some papers that are kind of coming out with some theories about Plaquenil to help with as an antiviral choice as well. So, these are the things that are making me optimistic.
Thank you for emphasizing.
Yeah.
this.
So
we need them. Lloyd Snook is coming on the show tomorrow. He's the city councilor. I'm going to ask you guys this question, and I will pass it along directly from you on tomorrow's show. So, you guys, what would you ask, or what would you like to see from leadership, 5 people that are in charge of the direction and vision of a roughly 50,000 person town?
So.
Don't give it to me now. Before you do, I got some other questions for you that are coming in. These are from other doctors. So Rachel says, is naproxen safe, or is it all NSAIDs?
All NSAIDs.
Okay, NSAIDs. Thank you. What's that abbreviation stand for?
Non-steroidal anti-inflammatory
drug.
Okay. So this question is coming in from multiple people. How do we best take care of our family that are elderly, that meet all the check marks of who are dying from the coronavirus? That question's come in 6 times, at least.
So the best thing you can do is what we're talking about. If it's at all possible, stay at home, limit contact. Kids are going to be your biggest vectors for carriers to give it to them.
Everyone should assume that they have this illness.
Assume you have it.
Assume you have it, and then think about what you're touching, who you're talking to, who you're close to. That you just assume that you have it.
I also want to talk about some other things you can do, right? Because we all get sick, whether it's this or other things. So, the best things you can do right now is you must eat healthfully. Eating is, food is medicine, and these are the building blocks of our health. So you definitely want to eat well. You want to sleep if you can, because it's a very stressful time. Sleeping is where, most of our healing takes place. It's where our immune system's most active. So you want to sleep. You don't want to do things like drink excessive amounts of alcohol. On my Facebook page, I love wine as much as the next person, but a lot of my friends were like, oh yeah, I'm going out to stock up on wine. And, probably really good to limit those kind of things right now. Not only because it, it doesn't do great things for our body, but also it's a depressant and,
dehydrating
and all sorts of things.
Drink lots of fluids.
Get outside where it's safe to be active, exercise. So, these are things you can do.
If you're feeling really anxious and out of control, put your feet on the ground
Can
and
we talk
feel
about
grounding.
the therapy? I mean,
yeah.
people are asking us to demystify therapy for once and for all.
Yeah.
And please emphasize, doctors, the importance of therapy. A lot of therapists and mental health professionals watching of the vulnerability here at a time of need.
Yeah, we have to process all these things that are going through, and like I said, get your feet on the ground, like feel how, like notice the things that are happening in this very moment, and how we are all okay right now.
Have you guys thought? And we're 50 minutes in here, and guys, we're going to try our best to get to all these questions. Andrew Pratt says, we appreciate you, Dr. Lindsey and Dr. Rebecca, so much. Thank you both for all you do. Love Andy and Brooke. And there's a ton of people that are giving props to Charlottesville Direct Primary Care and these two doctors for coming on the show and offering education and transparency and a sounding board, which was literally what we were trying to do here. Have you thought at all about what, and I know you're doctors, okay, just three people talking now, not doctors, about what like this world is going to turn into once we're post-coronavirus. I mean, it could be a world, and I'm not trying to get hyperbolize or exaggerate, but it could be a world where we're so mindful of past germs and diseases that restaurants could be potentially a to-go option only because people don't want to sit close in a dining room situation. Maybe I'm exaggerating.
I hope not.
Okay.
I mean, we are surrounded by illness all the time, right?
The education piece.
Yeah.
That's what I told Judah just a second ago.
Once we start doing education online, it's going to marginalize the need to do it in person.
Agree, completely.
Because we realize we can do it.
This is like 9/11. There's going to be a before and an after.
Right. It's like the saying, and I'll get out of the way and throw this topic to you. It's like, and this is very.
I'm going back to restaurants.
No, we totally get it. I'm going back to restaurants too, but it's like what I'm saying is like under great hardship comes great like innovation.
Yeah.
And
for
once we start figuring out that we're able to do these things.
When is somebody going to 3D print a ventilator? It's coming.
I mean, what else have you thought about like that? I'm sure you have.
I'm sure that there's lots of people sitting around thinking about innovation right now.
Right.
I'm super excited to see what comes out of this.
What are the medical innovations you think are going to be coming out of this?
Well, I think that probably ventilators are going to come out of nowhere.
Yeah.
But
we have people saying on the feed right now,
Yeah.
watch the pregnancy rate and the birth rate.
Oh yeah.
You guys talk about that?
Yeah.
COVID
That's no-brainer.
babies.
Yeah.
Right?
But somebody said something about
boredom breeds babies.
There was
Right.
like a generation called the Corona something.
the Corona
Right.
kids.
Yeah.
We also
Coronials.
Coronials.
Yeah, that's it.
Holy shit! I just heard that. I didn't hear that. Coronials, guys.
We'll
for
take the
everybody that's
humor where
watching.
we can get it.
Amen. A lot of people are saying watch the divorce rate for coronavirus
Yikes.
as well. I think that's apropos.
Hope not.
How about Charlottesville? UVA students. I went to UVA.
Me too.
Yeah. Are you double who?
Triple.
Triple who? Okay. So in my blood,
I know.
Charlotte,
It's so
UVA moving forward.
They
You
don't-
think about that?
Yeah. Hopefully, once we get through this, they're gonna do
Back on grounds?
graduation for these fourth years.
Yeah?
They have to have
Right.
that experience of walking the lawn.
Right.
My gosh, it's so sad.
What do you think?
I was funny. I was actually thinking about testing right now. That's where my head was. So my head's in Corona like 24/7.
Becky Calvert says, didn't Italy 3D print ventilators this week?
I hope so.
I
haven't heard that.
I know that France, like a lot of those countries are repurposing their industries in their countries to produce things that we need for medicine right now.
I know innovation also is happening because they're starting to put 2 people on one ventilator, which is new and unprecedented.
Wow.
Well, and Lauren Linsky, who's watching the show, she says innovation like the distilleries starting to make hand sanitizer now.
Louis Vuitton
right, that's
too.
what we're talking about.
Yeah.
So like perfumery is changing over and for those of you who can't get hand sanitizer, and I'm sure most of you know this, you can use rubbing alcohol. It has to be at least 60%. And that's very drying, so you can mix it with aloe vera or even a tablespoon of oil and some essential oils, and that is absolutely perfectly fine and a lot cheaper actually if you're watching your budget too.
Well, people are asking soap or hand sanitizer.
Do a little bit of both.
Yeah.
So you can do both, but I always go with washing your
Soap.
hands first.
Yeah,
So
agree.
a good hand washing will trump any day
Agree.
hand sanitizer.
51 minutes in, we have a conference call at 1:30. I still want to push it as close to 1:30 as possible
Sure.
because people are responding. What do you want to see metrics-wise or benchmark-wise from the community, say over say a 30-day interval? Or should we be looking at this in 30-day intervals? In
Well,
20
I think in week,
Day intervals.
day,
yeah.
day,
Okay, so
week,
I mean,
24
week
hours.
max.
What I want to
Okay.
say is
Okay.
that I keep looking at the Virginia Department of Health numbers, and I keep just waiting for the next positive to come in Charlottesville, But honestly, maybe Charlottesville is social distancing enough to keep it low.
Well, because there's only one, correct me if I'm wrong, only one official on
There's
the
only
record?
one official that we know of.
On the
Right?
record, and that was through UVA.
Right.
It was a UVA employee, is what
UVA
I know.
employee.
Yeah.
There's tons of scuttlebutt about other
Rumors
stuff.
everywhere.
Yeah, but we're only going to say one official.
That on the Virginia Department of Health, we have one in Central Virginia.
Can we say
in Charlottesville?
I'm a positive, glasses half full kind of person. You can call me a romantic, a dreamer, an entrepreneur, whatever you want to say. Glasses half full.
Yes,
Isn't that a good thing?
it's great.
It's a great thing.
Let's
But-
keep it that way, right? But
there's
we
other people who are positive and we just don't.
we
know.
just haven't tested. Yeah.
Because we've only done in the state of Virginia, as of today or yesterday, only about 1,600 tests in the whole state of Virginia. So the testing has just been so slow and so inadequate. So there's no way for us to really know the true numbers.
Yeah,
And-
we can't move forward assuming that it's not in community spread right now.
Do we feel excited, positive? This is a Twitter direct message. Do we feel, ladies, that we're in a better spot in a community with 2 hospitals in our backyard?
Yes,
Yes.
definitely.
Okay. So I'm trying to accentuate the positive.
We
here.
are
May
being
have known that
positive.
answer.
Yes.
Yes, we have 2
Yes.
hospitals. Yes, that's positive.
And I know that both hospital systems are preparing in a big way right now.
And we
So-
also have a community that generally really reaches out to help each other. And that's not necessarily true. I mean, Charlottesville, as we always say, everyone knows everyone. You can't walk down the street or down the mall without seeing somebody you know and saying hello. So this community is really good at helping each other out. And I do want to give props to supportcville.com.
Yeah,
the
please.
organization.
Yeah.
So, if you are...
Jordy.
Yeah, if you are interested in either how to help as you're in your home, you can donate money and other things. And then if you need help, you can also go on there to request help for certain things. And a reminder, as we are kind of in our houses more alone than not, please reach out to neighbors and
Yeah,
Call
good call.
them.
call them,
Call them.
email them. Don't stop over for tea, but call them, email them. You could be in different parts of the yard if you're far enough away. But other people don't have necessarily a group of people taking care of them, or if they have mental health challenges or disabilities, please reach out to other people in your community.
I'm going to close on this question for you to get to thinking about, and we'll throw it to you first, Lindsay, and then some comments. Lloyd Snook in that chair tomorrow, and he is going to advise council on a lot that comes up on the program. One of the reasons he wanted to come on the show was interface with the community so he could hear from the community concerns because they're not seeing people in person now at council meetings.
Yep.
And then he's going to take that perspective and relay it back to city council. And I'll literally say, Dr. Rebecca says this, Dr. Lindsay says this. What you would say to Lloyd. So before we do, some comments. Jill Miller Rockwell, thank you for accentuating the positive. I know we can't be naive and we need to remain vigilant, but I will always take positivity where I can find it. Also, I love Lindsey Neal. KT Sullivan, Beck, that's your nickname, Beck. Your dad and I are watching from the 40th floor here in New York
Hi,
City.
Dad. Hi,
We
KT.
want you to know we're very well fed, rested, and very proud of you.
Okay.
Aw.
My dad's one of those people who's
Love
at
that.
high risk. Yes.
Right. He's
So,
proud of you.
He's always proud.
I like that. You got a lot of doctors watching
Yeah.
here. Before we go to the final question, can
Yeah.
we welcome you back again?
Sure.
Sure.
Okay.
Absolutely.
Okay. What do you tell Lloyd Snook tomorrow? Advice you're giving the
So
counselor?
the two things I would say is, number one, check in with UVA and Martha Jefferson and make sure that they are getting the support from City Council that they need. They are the boots on the ground, the people that need to be thanked, and those are the people who I would want him talking to. Number two is, I would say take the restaurants that were here the other day talking with you, Jerry. They are making, they are being the leaders in our community right now because they are going over
Shutting down.
Yes,
Yeah.
by going over and beyond what the recommendations from the governor is right now. So I would say to Lloyd Snook to please support them in taking this step and actually asking the rest of the city and surrounding counties to all enforce the social distancing at home.
I love it. I'm going to say the
Right.
same thing. And I think it's going to start, and this is a topic for tomorrow's show. I think the meals tax should be suspended for restaurants, and not only suspended, but potentially halted for a little while, even after they reopen at full speed. And anyone who's watching this program, it's budgeting time with the city budget. If we don't have the meals tax revenue coming in, which we don't, this is going to impact schools, road infrastructure, the West Main streetscape. This is going to impact the fire department, which we highlighted on this program, and your lack of personnel. We do not have the money in the city we initially anticipated 2 weeks ago, and we're going to have to cut across the board. So the final word goes to Rebecca, the advice you give to Lloyd Snook.
I'm not really sure what I would say to Lloyd, because I'm not sure where city council ends, what kind of powers they have versus state, as opposed to federal. So I'm not sure, except that.
Sally Hudson's also watching.
Yeah.
So you
Hi,
have
Sally.
a Richmond delegate watching.
That's right.
Yes, I know. So yes, of course, financially, we want to do everything we can to, have some organization that can help these businesses when there is money available to help build them back up, that they get help in doing that. Because I know my brother-in-law, who owns a Carpe Donut, he tried to, after they were offering, the government was offering money for small businesses in crisis. It was a nightmare. So, any kind of group we could set up to help those businesses rebuild as quickly as possible, normalize life as quickly as possible would be great. So that's kind of where I am.
But in the meantime, everybody should stay home.
Everybody should stay home. Do we have 1 minute to talk about testing?
Sure. Can we go 35 seconds?
Yeah.
Okay.
So, guys, just so you know, testing is not available for everybody. It's just not. If you think you might have COVID, please contact your doctor so that they can triage you, see if you are a candidate. You may have COVID, and most likely they would tell you just to stay home and treat it like you would any other upper respiratory illness.
And to check in with us frequently.
And check in with us unless you become worse. Shortness of breath, or really febrile and just very unwell or have high risk. So otherwise, you're really not going to get tested at this time. Not that I support that. I wish we would all be tested as quickly as possible, but that is the reality where we are right now.
Yeah.
The exuberant and kind of high energized Jerry wants to give you a high five now, but we're not going to do that. You were unbelievable.
Thanks.
Seriously. And Randy Rose wants to emphasize that your dad is also watching.
That's right. Hey, Dad.
I'm also very proud of you.
We got proud dads.
Competitive dads.
Watching as we speak. You had a number of folks in Charlottesville, Crozet, and Central Virginia, and 13 states, 3 countries watching the program today. We will welcome them back. Everybody that's watching is asking where we can archive, get the show in its archive version. I Love CVille.com. The team upstairs will also turn this into an Apple podcast, and they're social distancing.
If people have questions, they can also
Charlottesville
email
Direct
us
Primary
Call
at
us.
Charlottesville Direct Primary Care on our website. Shoot us a question. It doesn't matter if you're not our patient. We just want to answer your questions so you're not in the dark.
Yeah.
There you go.
We're here for you.
Charlottesville Direct Primary Care. Fantastic at social media.
Yeah.
Yeah,
Thank
they're
you.
very
Yes.
quick to respond.
Yeah, that's right.
We will welcome them back, and we'll put this show out in the ecosystem on our network for the next 2 weeks. A little over 250,000 people. This is the I Love CVille Show. Tomorrow, Lloyd Snook.
Thank you,
To
Jerry.
talk about this. Thank you. You guys are
Thanks, Jerry.
Yep.
awesome. Yeah.
You're the best.
Have a good
Everyone
afternoon.
stay healthy. Stay
healthy.
home.
We'll see you tomorrow at 12:30, guys. Take care.
Bye.
Good work.
Yes, you too.
Yay.
Is that good?
Yes, it was great.
Good.
Man, you're the best.
Whoops.
So we got a
Little delay.
we got a